Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Today I want to talk about veneers. The definition of veneer is to be a decorative covering, and in dentistry, veneers are a thin porcelain laminate that is made by laboratories that is bonded to your teeth, and most typically you see veneers on front teeth. So patients often ask about what a veneer would do for them, and in today's video I want to talk a little bit about the pros and cons of veneers. So we know that it's a thin, very thin layer of porcelain that is made specifically for your tooth or teeth by a laboratory, made of porcelain, and the porcelain shade is selected so that it matches your teeth and it looks very natural. The size of a porcelain veneer is very, very thin. It's usually about a ½ millimeter or sometimes less. So what that means for you is that your dentist needs to take off about a ½ millimeter or less of the enamel on your teeth or tooth that are going to have veneers on them. Then the laboratory makes these veneers based on an impression that your dentist takes of your teeth and sends to the lab. The laboratory fabricates this very thin, very beautiful tooth-shaped porcelain veneer, sends it back to the dentist. You return to the dentist, so there are 2 visits usually involved in porcelain veneers. So you return to the dentist, and the dentist tries on the veneer and sees if you and the dentist both like the shade, the shape, and how it feels to you. And if everything seems to be a go, then that porcelain veneer is actually bonded to your enamel with special kinds of bonding techniques that really create a very tight and secure and safe bond with your own enamel. And now you've got a beautiful veneer. When do we most often use veneers? We most often use veneers for cosmetic reasons. So if a person has deeply stained teeth that can't be changed by bleaching, if they have spaces between their teeth that are wide and cosmetically undesirable, if the teeth are worn and chipped to a point where it is also cosmetically undesirable, and to replicate a kind of an illusion of having orthodontic treatment. So if you have some front teeth that tend to be a little crooked and overlap each other, sometimes we can do a little bit of magic with porcelain and veneers. So those are the most typical types of situations that you will see people use porcelain veneers. They're very durable. Once they are bonded to your teeth, that bond strength of the porcelain to your enamel and your tooth is very, very strong. However, the flip side to that is you don't want to bite your nails, bite down on pencils. You don't want to pull your jacket sleeve off with your teeth. Those are kinds of things that test out the strength of the veneer more than they should be tested out. People that have heavily restored front teeth that have had many, many, many restorations over the years, are not necessarily good candidates for veneers. A couple of fillings that have been filled on the front teeth, that would be okay, but if you've got gum disease or heavily restored teeth, you're probably not a great candidate for veneers, but you can check with your dentist and talk about your concerns and see what your dentist says about that. Sometimes patients will experience a little bit of sensitivity after having veneers placed because you have had your tooth or teeth prepped a little bit, what we call prepped, taking off that about ½ millimeter of enamel, and sometimes that can lead to some sensitivity, but not always, and your dentist can talk to you about options as to how to decrease that sensitivity. So veneers are a wonderful solution to cosmetic issues, to closing gaps in teeth, to creating a white and beautiful smile. Porcelain does not stain. That's a great advantage. The disadvantage is that if you want to bleach your teeth after having porcelain veneers, you might see a difference between your natural teeth and the veneers shade that you had picked based on the previous shade of your teeth. So a big suggestion that I give to patients quite frequently is if you want to bleach your teeth, now is the time to do it before we begin doing the porcelain veneer preparation. So get your teeth to the whitest possible shade that you want them to be, and then go to your dentist and have the porcelain veneers taken care of. So the great advantage to porcelain veneers is that they don't stain, but on the other hand they don't bleach up either, and so you need to be mindful of that. They're a great option. Talk to your dentist about porcelain veneers if they're something that you think that you would like to do. They're easy, they're safe, they're pain-free, and the result is just beautiful. So you'll have a wonderful smile with porcelain veneers. That's what I wanted to talk to you about today. I've got a fly in front of here. And if you have any questions, please feel free to call us or email us at info@parkridgedds.com, and I'd be happy to answer your questions. And remember, as always, we love making you smile.